So I've been having like neck pain and palinopsia, like after image when I look at a bright light and I see like sort of an after image after.
Gotcha. And what time of the day you notice is the worst?
At night.
At night.
Yeah, my night vision is terrible.
Okay. So what about driving at night?
It's hard. I see kind of like if I look at a bright light, it'll kind of like take a while for me to acclimate to the darkness.
Gotcha.
Yeah.
But those who are not familiar, okay, after image, especially when you're driving at night, is like seeing like, okay, you got like one image over here, and then
For a split second, you see it again.
exactly, and then there's like, even though you drive past the sign, the road sign that's like illuminated by your headlights, that image is still there. It's like burnt in there.
Yeah.
Okay. So that's what after image is. So for those who try to remember way back in the old days, like the CRT TVs, you leave the TV on for too long, you turn off the TV, the image is still on the screen.
Oh, yeah.
Right? So that's what after image is, palinopsia. So we're going to take a closer look, see what's going on in terms of that neck region and also everything else, what caused that in the first place. Right?
Awesome.
All right, so we got something going on over here. Go ahead, I'll your march in place. Okay, so just a little bit stuck there. Okay, that's really deviating. All right, so here's a bottom line, right? Normal, I want to see it moving like this. This is already a little fixated, not moving too well. But when I check on the PIS, it should go underneath, following along the leg. This one over here is going diagonal. That tells me, no, there's an EX misalignment over there. So based on the history and also this gait analysis, gait analysis as well, and also looking at his x-rays over here, right? And also based on past experience dealing with other palinopsia patients. Palinopsia usually I notice is in the mid to lower cervical area, typically the fifth cervical, okay? So, and also I already see that that's glaring, sticking out a sore thumb on the x-ray. So we're gonna take a closer look at that area over there. But in addition to, we also wanna see, what caused this to flare out and come out as well. Because usually it's like the final straw broke the camel's back and just bam, it gives out. So I wanna take a look at what's going on in the foundation. The x-ray shows that there's some kind of issue going on there as well. And we'll touch base on it in a moment. So looking at in terms of visualization, we already see over here, we have a lot of muscle spasms going on the left-hand side. There's a lot of swelling on the right-hand side. Trace it down. Okay, we got puffiness and swelling over here. And then we trace all the dirt straight down here. It's okay, so what's going on there? This is swollen over here. And this is also puffy over here too. So now, those are indications of potential signs of an inflammatory process. So that's what this device is looking for. This device here is looking for, is there any particular potential damaged tissues in the region, resulting in nerve dysfunction, what we call a subluxation. Now this is not a definitive tool, so that's what makes the Gonstead method so effective, is because we don't rely on just one objective data. We rely on multiple objective data to reach a proper conclusion. Says, hey, this is the actual one we really need to address. Because the saying goes, if it ain't broke, don't fix it. And I don't want to mess with anything else unless it's a real actual problem. And there we go, right there.
See, there's one gap right there. It's tender right there?
A little bit, yeah.
Yeah, see it's swollen right here. Yep, that ain't moving. The shape is actually pretty decent there. How's this fifth lumbar?
Oh.
Yeah, not too fun right there. Huh?
No.
It's not. Now here's the thing. If I push it forward, P to A, it moves just fine. But the moment I raise it, I to S, see that's stuck.
Tender right there, right?
Yeah.
So it has one heck of a inferiority over there. And I'll point that out later on in the x-ray. How's that right there?
It's tight. It feels like really tight.
Yeah. Yeah, got that's feel that huge knot right there?
Mm-hmm.
Your body's guarding and protecting, trying to stabilize something that's very unstable here.
Mm-hmm.
I'm gonna check. How's that feel right there?
It hurts. Definitely, I hear like crinkling, like I guess.
Yeah, that's a fifth cervical right there. Okay. All right, so I found some potential areas. We got the right hip. Looks like the fifth lumbar. Okay, we got this mid dorsal over here. Look at this fifth cervical over here. So, in terms of your case, right, what's causing an after image? Now, if there's any type of little misalignment resulting in that nerve interference, the body cannot relay that and coordinate that information properly. We do have nerves from the optic nerve, okay, go straight to the back and over here, right? But also, just like over here, as I mentioned before, goes to here, we also have sympathetic and parasympathetic nerves, which means sympathetics, best way to explain it, gas pedal makes everything go faster. Okay, parasympathetics makes things like a brake pedal, slows things down. So we do have both parasympathetic and sympathetic nerves, and it branches off. Now the interesting thing about it is that it loops all the shit down here, right down to the lower part of your neck, and come right back up. Right? So if you have a misalignment here, okay, it may cause a potential disruption to that your pathway for your eyesight. Okay, so just like I explained before, after image, that even though you saw a bright image and then and you pass by it, it just still stays there.
Yeah.
Right. Your brain's supposed to clear it out, but it doesn't. Right. So now that's what we're gonna address. We're gonna restore the nerve pathway for this. Now I'm not saying like just like a traffic jam on a highway. I'm not saying like all 5 highway lanes are like shut down and we've got 0. That's not the case. But we definitely got like from 5 lanes, okay, 1 lane's closed down. We got one heck of a traffic jam there. It's just not relaying that information properly.
Yeah, of course.
And also another way to put it is sort of like saying today, we're trying to order takeout food and I want to order it and have it delivered to 4B. So did you say 4B or 4D? Sounds very similar.
Yeah.
So that miscommunication, that a slight little, short circuit going on there may help explain that. Okay. So we'll take a look, see what's going on. See this width over here? This width over here? This is much more narrow. This line over here, normal is supposed to be smack in the middle. You went way over to the right. That means your whole entire body, okay, what it did was it started rotating towards this.
Okay.
Now we can't walk this way. All right? So what your body started doing is, the funny thing is, it immediately started compensating over here. Okay. So even though your pelvis rotated this way, the rest of your lumbar spine, it twists like this way. All right. So that's what makes this one a little tricky how I'm going to adjust this. So once again, this hip went this way. The rest of the spine is supposed to go that way, but it didn't. It counter rotated this direction. So now in the textbook, it states that, it says, typically we will adjust and pull this over here. The problem is your spine's already this way. So if we pull it, we're going to rotate even more to the left, what we don't want to do. Whereas if we do a push maneuver, I'm going to realign this right hip and also 2 birds, 1 stone, it's going to realign your lumbar spine as well. So why is that important? Well, we see everything's all twisted up and it's going straight up to your neck. All right. But here's the thing, your atlas it's also twisted and rotated as well. Now, another key component I'm also seeing is this. That's why your 5th lumbar vertebrae is also in trouble. Okay. Normal, I want to see your sacrum, the foundation, in normal 45-degree angle. Instead, it went forward. It went anterior.
Okay.
This bone, the 5th lumbar vertebrae, it went backwards and tilted backwards like this.
Okay.
No different like a chair, leaning on its last 2 legs and going way backwards. Now, it's not a recent problem. It's been there for so long. We see the nucleus pulposus, which is a ball bearing, as this fell over here, it went backwards. It went backwards like this. And it's been there for so long, it dented the bone itself. So that's what I see over here. Not just this one, it affected this one here, affected this one here, affected this one here, affected this one here. We also have a stair-stepping effect. That means
Usually if it's just one that's misaligned, no, it went backwards like this, and another one right above it also went backwards, another one went backwards. So it's sort of like the whole entire Jenga tower, all of it. It's like, okay, we got all these pieces ready to topple over, right? And also that's what we draw the gravity line over here. Right now, your horizontal lumbar spine, you're going way over like this. So to compensate, your body had to go like this.
Yeah.
Right? So that's what causing all the severe instability over here. So I need to address this one over here, and I also need to address this one immediately afterwards. I don't want to do it too close by, but we don't have a choice because of this inherent instability what we have in the lumbar spine. Just to deal with, to help stabilize that fifth cervical over here. And also, I'm gonna double check, see what's going on, see if we need to address that one as well.
Okay.
Let's rock and roll. Here's it. Oh, there it is.
Yeah.
Walk around. All right. Tell me, what's different?
I don't know.
Okay. How's your vision?
I can't really tell right now.
Okay. Let's test this real quick.
Okay.
Look at that. And look at our angle.
It definitely improved.
By
Definitely
how
improved.
much?
By a lot. By a lot. Yeah, definitely by a lot. I'm actually, wow. Wow, by a lot.
Well, define what's a lot from 0 to 100%.
I would say like, look, 80%.
80%.
Yeah.
That's good. So that's what I was explaining before, the foundation. Okay, we want to address the root cause of the problem. So because this right hip, it went out, that's where it affected like dominoes, or scraped the neck itself. But you're still not out of the woods yet, so we're gonna double check, see what else is going on, everything else.
Okay.
So by addressing that right hip, what it did was it brought the sacrum a little more posterior, realigning with this. But no, when I just tested on you right now, okay, this fifth lumbar, the inferiority is still there, we still need to address this one.
Okay.
Drop the button. Keep on going. A little. There's that fella. Just relax. A little more. Drop shoulder. Here's one. Let it go. Okay. All right. Is that over here? Just dry side.
Wow, it's really good.
Really good in what way?
Like, I don't see the after image as much at all.
So you said 80% last time. How's it now?
I'm trying to, I don't want to like get too excited. Hold on. Like, I just want to. It's at least 90 because I could see it for like a ton, like almost like a millisecond.
Nice. Okay, now I know. Rest your eyes.
I know. Yeah.
No, you can stand. Okay. All right. So that's what the store is going to be. All right. I need you to ice this over here. So as the viewers can see, there's a lot of swelling in the back of your neck. You're gonna pump all that fluid out. Okay. So eventually it'll get to closest to 100% as much as possible. Okay.
Awesome.
20 minutes, 3 times a day. I'll see you next visit.
Awesome. Thank you. Thank you.
Hey, not a problem.
Thank you.
Have a good one.